Welcome to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on cutting-edge medicine. I'm your host, Ashley Russo, and we have an informative and exciting show for you this evening. We're talking about innovations in radiology, and we'll be discussing what services are best suited for patients when determining their care. We'll be joined by a panel of medical experts from St. Luke's Radiology. Stay tuned. This is St. Luke's Health Now. Up on this episode of Health Now, an in-depth look at innovation in radiology with St. Luke's University Health Network. Stay tuned. Thanks for being here. Let's get started. We have an accomplished panel of guests joining us tonight. Up first, we have Dr. Michelle Naylor. Dr. Naylor completed medical school and residency at Drexel University College of Medicine, Hahnemann University College of Medicine. She did a fellowship in women's imaging at the Mayo Clinic in Arizona and was the section chief of mammography at Hahnemann University Hospital. She joined the St. Luke's team in 2019 and now spends all of her clinical time working in the breast imaging centers, specializing in all modalities of breast imaging and image-guided procedures. Dr. Naylor, thank you so much for being here. What got you started on your career path, and how did it lead you to where you are today?
So I actually always knew that I wanted to be a doctor, and throughout medical school and my training, there were many different areas that interested me. But when I came across breast imaging, I knew it was a great match for me. It's something that I'm very passionate about, and I feel like it gives me a lot of opportunity to help save lives.
Great information. Thanks, Dr. Naylor. Joining our panel next is Dr. Janet Durick. Dr. Durick joined St. Luke's in October 2019, having been on staff at the University of Pittsburgh Medical Center for 17 years, where she served as the Vice Chair of Academic Affairs. She was recently appointed as the Section Chief of Chest Imaging for St. Luke's University Health Network. Her areas of interest include the imaging of lung cancer and interstitial lung disease. Thanks for being here, Dr. Durick. Dr. Durick, you're new to the Lehigh Valley and you're new to St. Luke's. Tell us a little bit about what your experience has been like and how it's been treating the patients of the Lehigh Valley.
One thing that I've found here that was really a surprising and refreshing change was just how much of a sense of community there is in the hospital. Anytime I've needed help with something, people have been so friendly, and it really feels like a team effort here taking care of patients. Sometimes coming from a big academic medical center, everyone is feeling a little more hurried, but I really feel the sense of putting the patient first from everyone I've dealt with.
So glad to have you here, Dr. Durick. Thank you. Let's meet our final panelist, Dr. Lori Sebastiano. Dr. Sebastiano is an authority in body imaging and women's imaging and has served as Section Chief of Ultrasound for St. Luke's since 2000. She pioneered the use of MRI for breast disease in the Lehigh Valley and has many years of experience in all breast imaging modalities. Her love of technology and gadgets are a perfect match for incorporating into the daily high-tech, rapidly changing world of imaging. Welcome, Dr. Sebastiano. Tell us a little bit about your interest in this field and what drives you to continue to help patients and to really learn more as technology advances in your career.
This is kind of the best way that I've been able to explain it to my kids when they were growing up. I really like to do games and puzzles and technology. And the way I feel like it was explained best to them, like what I do and what I love about it, I told my kids when they were growing up that I'm a professional Where's Waldo finder. I spend all day looking for Waldo, but a lot of times Waldo's not there, and but I'm still looking for him. And the benefit is that I kind of feel like I'm doing puzzles all day, but it helps people at the same time. So it's kind of cool that way.
Incredible. Thank you all for giving us so much great background information on your expertise in radiology. Next, we're going to dig deeper into the basics of innovation and radiology at St. Luke's. Stay tuned. We'll be back after a short break. You're watching St. Luke's Health Now.
St. Luke's continues to make sure patients always have access to leading medical technologies, no matter where they receive their St. Luke's care. St. Luke's recently cut the ribbon on a fleet of the most advanced ultrasound technologies from GE Healthcare, raising the bar of imaging and ultrasound to a level not seen in the U.S., creating consistency in radiology, vascular, and cardiology services throughout the network.
Welcome back. Thanks for being with us tonight. I'm Ashley Russo, and this is Health Now. We want to thank our viewers for watching our program tonight and for providing us with questions for our panel before the show. Joining me is a talented panel of medical professionals, Dr. Naylor, Dr. Durick, and Dr. Sebastiano. We've learned about their backgrounds and expertise in the field, but now we want to talk about some of the basics of radiology. So Dr. Naylor, I'm going to start with you, a question that all women are always asking, which is, why is it important to get your yearly mammogram? When do you start getting it? And why is it important to be on top of your breast health?
So this is something that I'm very passionate about. I think that the annual screening mammogram is a great way for patients to stay on top of their health. It's a great idea to be aware of your breasts and what they look like so that you know if there's any change. So things like the overall size, how they look in the mirror, whether your nipple is flat or points out, those types of things are very important to pay attention to. The annual screening mammogram is a great way for us to find cancer early. That means that the patient may need less treatment overall and can have a better outcome, meaning they can live longer if we can find it sooner.
Well, a lot of women talk about the screening mammogram because they might go to their OBGYN hopefully regularly and they're getting a prescription or they're hearing about it in the news. But there are lots of other screenings that are also really important. So Dr. Durick, I want to talk and turn to you about the screenings available for lung cancer. And what are they, and have you seen an increase in detection rates since St. Luke started offering these screenings?
So in terms of lung cancer, there's one test that's offered for screening for lung cancer, and that's a CAT scan, or you might have heard of called a CT scan. And it's a very simple test. It doesn't require being poked with the needle to start an IV. It doesn't require drinking any contrast material, which individuals may have had to do for an abdominal CT. It's a quick test that takes about 5 minutes, lying on a table, passing through a donut type piece of equipment, and getting that's how the CT scan is done. I have definitely seen an impact made and lives saved by lung cancer screening, because much like mammography, we can catch cancers in the lung much earlier before they've even spread or patients have become symptomatic, and save lives that way.
Often people are afraid to get screened because they're afraid it'll find something, but I hear you all saying that finding something is really where you can help patients the most. And Dr. Sebastiano, liver disease is no exception to that. So I know that there are some screenings. Elastography, am I saying that correctly? Tell us, what is that and who's a candidate?
Elastography is a type of ultrasound. So for anybody who's had an ultrasound, they know that it's also it's a painless study. Again, for that too, you don't need any needles or any drinking of anything. It's looking at the elastic nature or the soft or stiffness of an organ. So if you have disease in an organ, that causes scar tissue. Scar tissue causes things to become stiffer. So elastography is a simple ultrasound test that's non-invasive that looks at the stiffness of the liver.
And another benefit, I suppose, is that ultrasound does not use radiation, correct?
That's correct.
One of the things that people worry about, Dr. Naylor, is when they are going for testing, if they get called back. So maybe they had a screening and they said, we want to look at something a little more closely. And they're called back for a diagnostic image or a diagnostic study. What is that? What does it mean? How does it help? And what are the concerns you hear from patients that you can maybe debunk for us?
Diagnostic imaging means that we saw something on the screening mammogram and we need to get more images to know more about it. So the vast majority of the patients that are called back will get either a mammogram or an ultrasound or both. And at the end of the study, we give everyone their results. So a large portion are actually going to be negative, meaning we thought there was something there. We took some extra pictures. It's nothing to worry about. We don't need to do anything else. So she can go back to screening. So that's great. The other option is sometimes there's something there, but it's not too worrisome. And we think it's safe to look at it again in 6 months. The third option is the more scary option. It's when there's something there and we think it does need to be biopsied or sampled. The doctor and a nurse will come in and talk to the patient and give them the results and talk about what to expect for the biopsy. And we kind of guide them through that process and help them make their next appointments and answer any questions they have so that when they leave, they know exactly what's going on.
Really important that people know that they need to follow up and they can get answers quickly. There's no more waiting for those multiple weeks and sometimes months that patients used to worry about. You know, Dr. Durick, I want to ask you a little bit about artificial intelligence. We hear a lot about it. I know that it helps me know what shoes I'm supposed to buy, but how is it helping us in medicine and how is it helping you physicians and us patients with the work that you're doing?
So artificial intelligence in radiology is, in essence, a computerized method of taking the skills that we have as physicians and making them even better through the use of computers. Our studies are very complex. One study may have 1,000 or more images, and we're human, we can make mistakes. So in one way, artificial intelligence helps us make fewer mistakes and find the abnormalities. In another way that it helps us take care of patients is that it can prioritize studies. It can find an abnormality on an exam before we've even looked at it. It can alert us that that study has an abnormal, potentially life-threatening finding, such as a collapsed lung, and let us know immediately that that image needs to be looked at and that patient needs attention.
It really is so incredible how that technology is aiding radiologists. And when I think of Dr. Sebastiano's example around Where's Waldo, it might be nice to know that there is no Waldo on this page. And if nothing flashes up, you maybe don't need to continue looking for him. So thank you, Dr. Durek. Dr. Sebastiano, you know, we're talking about disease of the liver. How common is that? Is it something a lot of people need to be worried about? Who is a candidate for diagnostic testing? And how do they even know where to begin?
There are many different types of liver disease. Some of the ones that we're looking at for this test, the elastography and UGAP, the common ones that people have heard about are probably hepatitis or cirrhosis. Cirrhosis is just a common term for an end stage scarring of the liver. It's hard to know if you actually have any of those things because it tends to be a silent process, and you often don't know that you have fibrosis or cirrhosis of your liver until it gets to those later stages that causes a problem. So one of the things that your doctors do when they interview you, they'll check your weight. They ask you how much, do you drink alcohol? How many drinks? That's them screening the patient for their risk factors for having more of that silent underlying liver disease, that fatty infiltration of the liver, because we can find that earlier now.
Really intriguing information from all of our panelists, but we're not done yet. After the break, we'll learn more about technology and treatment options from the radiology department. You're watching St. Luke's Health Now. Stay tuned.
I was scheduled for a mammogram. Everything else I'm willing to do. Mammograms, I'm always a little reluctant to do. Being a woman and sort of dismissing the fact that mammograms are important, they are important. They are one of the greatest tools that women has available to them. And this is just another tool in our arsenal. When I got the results on the phone, they told me there was an abnormality and they needed more diagnostic testing. So what they did was offer me an appointment that same afternoon if I would be willing to drive to Center Valley, and I was very willing to drive to Center Valley. I was very nervous about going in. I went in, but as soon as I met their smiling faces, I was really put at ease. The more in-depth showed that there was a mass behind my right breast. And so they took me in just a few minutes into the ultrasound. The next step in the process was that they did need to do a biopsy. And at that point I said, sure, when would you be willing to do that? And thinking it was another week or two out. And they said in about the next 5 minutes. One of the nurses volunteered to stay and hold my hand through the entire process, and she did. Hearing the results were benign was such a huge relief. When you think about the one-stop process, it gives you the ability to get everything done at one time so that I didn't have to worry and have my family worry. I love St. Luke's, and I am so happy they're in our community.
Welcome back to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on cutting-edge medicine. I'm your host, Ashley Russo, and we have an intriguing show for you tonight. We're talking about innovation and radiology, something a lot of us wonder about but often don't know about. So in case you're just tuning in, I've been joined by 3 St. Luke's medical professionals, Dr. Naylor, Dr. Durek, and Dr. Sebastiano. Thank you all for being here. Now we're going to talk about technology and advancements throughout the entire network. Dr. Sebastiano, I'm going to start with you. St. Luke's has made an incredible investment in ultrasound across the network, but we think of ultrasound as being around for a long time. I mean, it's one of the first modalities, and yet they're making an investment. So How has it been advancing, and why is it important that St. Luke's continues to invest in the technology?
Well, ultrasound is a very rapidly changing environment, though. So trying to keep up with the times is not always easy. So it's kind of like a cell phone. Those cell phones change over pretty quick. And, if you just think back to 5 years ago, what your older cell phone was like and what it could do compared to what you have now. So it's kind of the same way. And it's not like our ultrasound machines that we've been using were old. They truly were only, somewhere between 5 and 7 years, in which you would think that's rather young for medical equipment. I was thrilled to be able to get all the advancements with all the new toys and new bells and whistles. It's amazing to be able to have all these new modalities to help the patients.
I like your comparison of a cell phone because it really is true. Every couple of years, we notice our batteries start dying and they're like, oh, that's got the new this and the new that, and we want that. So, of course, it's great to know that our healthcare is doing the same for us. Dr. Durick, talking about an investment, St. Luke's has a long-standing relationship and partnership with GE Healthcare, and they've got some interesting technology that's got that AI built in. Can you tell us a little bit more about that?
The radiologists at St. Luke's are working very closely with the team at GE to determine which clinical problems in radiology would be most helpful to have solved with an artificial intelligence solution. And the one area that we are currently using is what I mentioned before, the pneumothorax or the collapsed lung. So we now have artificial intelligence deployed on several of our X-ray units that can detect a collapsed lung before we have even looked at the image. And again, because some of these images can be very complicated in patients who are very sick in the ICU, they've got lots of implements overlying them. They've got lots of catheters. A collapsed lung can sometimes be difficult to see, and the artificial intelligence can alert us to that collapsed lung in a patient where it might otherwise be overlooked.
Wow, what incredible advancements that allow AI to work with doctors and nurses right on the ICU floor in real time. That is incredible. Another technology that has come along, Dr. Naylor, is this fast breast MRI. Why might a patient want this supplemental imaging, and who's eligible? Of course, everybody likes anything with the word fast in it. So what does it mean?
A fast MRI has been tailored to look for breast cancer, and it is a little bit shorter than a traditional MRI study so that we can offer it to more patients and decrease the cost of it. It basically is another screening test to look for cancers. People that have dense breast tissue can sometimes have cancers that are really hidden on mammogram. So this is another test that can look at dense breast tissue and find more cancers than screening mammogram, and also finds more cancers than screening mammogram with screening ultrasound. It's great for people with dense breast tissue, but it will find more cancers in other breasts as well.
And it's becoming more and more accessible, correct?
Correct. We are starting to offer it with one of our sites in Upper Bucks, but we hope to expand that into our other areas, north and south and east and west, so that we can offer it to everyone in our region.
One of the things that happens at a network like St. Luke's is you grow, and there are many, many locations across a very large geography now. And Dr. Sebastiani, you've been with the network since 2000. You've watched that growth happen. Why is the consistency of technology across the network so important? And why do patients in our audience need to know that the technology that you will find, whether you're in Upper Bucks or you're in Monroe or you're up at, out west somewhere in Allentown, will be the same, and you will have access to that same level of technology? Why is that important to you as a physician and to us as patients?
When we had multiple different levels and different ages of machinery, we found that we were shifting patients. Either we would shift them from one room to another, and then the patient might have to wait longer. So now with all the brand new equipment, all the same level, all the same high technology, we don't have to do that shifting.
Really important for that consistency. And Dr. Durick, we mentioned a little bit about lung screenings. Who is a candidate for that? Who should be asking their doctor for it? This is something St. Luke started several years ago, and it's been so helpful, as you mentioned earlier, in your field. Who is looking for that, and where do they get started? Who do they turn to even know they need a screening?
Lung cancer screening, first of all, is only for smokers. So while some folks may have a family history of lung cancer, or some people may have been exposed to secondhand smoke, or may be concerned about radon exposure, or things like that. The previous guidelines were the ages of 55 to 80. The new guidelines are 50 to 80. And also the previous guidelines, the number of years smoking had to be what's called in pack years, 30 pack years. So you take the number of packs per day that you smoke, you multiply that by the number of years that you smoked, and that gives you the pack years. So the newer guidelines take your smoking history down a little bit. You don't have to have a 30 pack year smoking history, but only a 20 pack year smoking history. And those new guidelines just came out on March 9th of this year. So if you meet those requirements, you'll have to talk to your physician because you will need a prescription for this test. And they also will need to counsel you on smoking cessation in order for you to have this low dose lung cancer screening chest CT.
That's a pretty significant change, and really one that I would imagine is very helpful for patients. And another change that's happened, Dr. Naylor, is talking a little bit about the way diagnostic breast care was done in the past and the way it's being done now. So there's this one-stop breast clinic concept at St. Luke's. Tell us a little bit more about that and how that's changed the patient experience and outcomes.
Before, the older way to do things was to come in and have your diagnostic imaging done. If you needed a biopsy, you could schedule it that day, but it wouldn't happen for a couple of days to a week or so. And we are just really trying to shorten up that timeline to decrease anxiety. So we created this one-stop clinic where a patient can have her diagnostic imaging and her biopsy on the same day. And then we're also working with pathology to get the pathology results very quickly. So the goal is to have everything done from the additional mammogram images to the pathology results in 24 to 36 hours to really just decrease that timeline and help get people answers.
Great, engaging conversation. Up next, we'll hear questions from our viewers. Stick with us. You're watching St. Luke's Health Now.
When you're a woman who is at risk for breast cancer, oftentimes there is just not enough that you think you can do to ensure that you are healthy and staying healthy, and you want to take every opportunity to do any studies adjunct to mammography that will help ensure that you are in good breast health.
Fast breast MRI is performed in about 10 minutes versus the conventional full diagnostic breast MRI, which takes around 20 minutes, so it is much quicker. And it's only obtaining the most select and most important sequences needed for the detection of breast cancer.
Fast breast MRI is new to St. Luke's network, and we're actually offering it to start at our Upper Bucks campus in Quakertown. Our goal is then to expand the service to other hospitals geographically and strategically located throughout the network to ensure all women have access.
At St. Luke's, we try to stay at the leading edge of the technology curve. We want to be able to offer the most advanced imaging tests available to our patients to improve their health.
It's easier now more than ever to stay on top of your breast health, and doing a fast MRI or an automated breast ultrasound adjunct to your normal mammography each year just gives you that added confidence that you're okay.
At St. Luke's, we work as a team to provide the best possible care for every woman who comes in for an imaging exam. We have robust communication between all team members, and we work well together to provide the best service possible.
A woman having the fast breast MRI study will be met by the dedicated team of breast MRI technologists, and then her study will be interpreted by one of our fellowship-trained breast imagers.
It's a humbling opportunity to be involved in women's healthcare, and we strive to provide the best clinical service available.
Welcome back to St. Luke's Health Now. I'm your host, Ashley Russo. A special thank you to our outstanding panelists. We've had a great conversation about innovations in radiology at St. Luke's. Now we're going to read some questions from our viewers. I'd like to start with the first one, and I believe that Dr. Durick, this will go to you. This viewer asks, I've been a smoker for most of my adult life. What's the point of being screened if I know that I'm already high risk?
Well, the point of any screening test is to catch a disease process early where it can be treated and you can be cured. The American Cancer Society predicts 132,000 deaths from lung cancer in 2021. And with appropriate screening, they estimate that between 30,000 and 60,000 of these lives can be saved. So it's really about saving your life and catching something early while it can be cured.
That's a really huge percentage of people whose lives could be saved just by getting a screening. That's incredible. All right, Dr. Naylor, this one is for you. This person asks, do I need a prescription from my physician for a fast breast MRI?
Yes, so you do need a prescription from your physician for the fast breast MRI.
And how do you know if you need to ask for that? Is that something you should discuss with your OBGYN at your regular appointment? How do you figure out that that's what you need?
The fast breast MRI is really recommended for people who are average risk for breast cancer, especially if they have dense breast tissue. Once you have your first mammogram, the report will actually tell you which breast density you have. There are 4 densities, and the first 2 are considered not dense, and then the second 2 are called heterogeneously dense and extremely dense, and they're both considered dense. So if you have your screening mammogram and it comes back as dense breast tissue and you're curious about additional screening options, you can talk to your doctor about that.
So it's most important to go for that first mammogram and you can go from there. All right, Dr. Sebastiano, I'm going to throw this one to you. This audience member writes, how do I work with a family member who refuses to see their doctor for any type of screening because they're scared that something is wrong with them and that something will be found? What do you say to that family member?
I understand, and that is a very difficult position to be in. And I just try to reassure them that if you do go for these screenings, you can find these things much earlier when you can still do something about it. And rather than being afraid of it being abnormal, you want to find that abnormality early rather than waiting until it's something that you can't do anything about. The test that we were talking about with the elastography, it's such a simple test. It's only 10 to 15 minutes. It's completely painless. So why not have that painless, simple test and to be able to avoid very severe consequences later?
All right, this question I'm going to send over to you, Dr. Naylor. My mom and grandmother both had breast cancer. Should I assume that I'm also going to get it, and am I a candidate for genetic counseling?
So I would never say assume that you're going to get it. So even patients who are at high risk for breast cancer or patients who have a genetic predisposition to breast cancer are not at 100% risk. You know, we put patients in high risk categories, and typically we're talking about a 20 to 30% lifetime risk of breast cancer is considered high risk, which means 70 to 80% of those patients are not going to get breast cancer. So it is scary to think that maybe you're high risk, but it does not mean you are absolutely going to get it. Talk to your doctor about the specifics of your family history. Tell them who had cancer, what age they were diagnosed, that type of thing, so that you guys can come up with a plan together that best suits you.
Great answer, Dr. Naylor. All right, I think we have time for one more. So Dr. Durek, I'm going to end with you. This viewer asks, do you see the trend with artificial intelligence continuing in medicine to help diagnose disease?
I think the trend is just going to be that it's going to explode in the future. Like Dr. Sebastiano said, just as our cell phones, we keep updating them because we get newer and better technology. We're going to have newer and better ways to detect disease that are going to help us as physicians build on the skills that we have taken years to perfect. It's going to only get better and more all-encompassing in all fields of imaging and medicine as well.
Well, it's really exciting. I love seeing the advancements in technology, but more importantly, the dedication and the passion of physicians like yourselves. Thank you so much to our panel for such insightful information, and thank you to all of you for tuning in. For more information on innovation in radiology at St. Luke's University Health Network, please visit their website at sluhn.org or call InfoLink at 1-866-ST. Luke's. I'm Ashley Russo. This is St. Luke's Health Now. Thanks for tuning in. And until next time, be well. And remember, it's important to focus on your health now.